Okay, ma'am.
Ready? So, yes, considering this critical care scenario, please tell me how would you manage this patient now?
Okay, ma'am. I'll consider the patient management, the critical care protocol system, because
Yes.
the patient having the thyroidectomy, then he's suffering from tingling carpopitular spasm. So I'll consider the patient suffering from a hypocalcemia. So
Okay.
I'll
According to
yeah,
which protocol are you going to
CRIPS
take
protocol, ma'am.
CRISP? Okay.
Yes, I'll check the airway. If patient is can talk, airway is all right. Then the breathing. I'll check the chest movement, circulation, and I also uh, consider the oxygen saturation, and I'll take the cardiac monitoring by ECG the patient.
Okay, very important. When considering or thinking of managing a patient who's post-operative thyroidectomy patient, what is the main thing that you would consider?
Yes, I will manage the hypocalcemia of this patient.
Yes, but what is the major thing that you'll be worried about?
Yes, a patient may have suffering from the laryngeal spasm.
Spasm, yes, very good. So once the labs have returned to you and you realized serum calcium levels are 1.7 millimole per liter, what do you interpret from that?
Okay, ma'am. This patient, at first I will give the 10 ml 10% calcium gluconate over 10 minutes, followed by 10 to 40 ml saline infusion over 4 to 8 hours, and titrate the doses if required. And as well as I'll manage give the magnesium sulfate 2 gram 10 ml over the 10 minutes.
Okay, my question was this levels, how
Yes,
much should be the normal level?
yes, sorry, ma'am. It's a 2.2 to 2.8.
Okay, so this one is lower level. That's
Lower,
why you are
yes,
giving.
ma'am.
Okay, why are you
Yes.
giving magnesium? Yes? Why would you think of giving magnesium sulfate?
I
Are you
can
there?
say, ma'am, now.
You don't know right now. Okay.
Yes, ma'am.
Uh, Post-operatively, can you tell me what might be the cause of post-thyroidectomy hypocalcemia?
Yes, the removal of the parathyroid gland or the ischemia of the parathyroid gland.
Okay, two reasons, right? Okay,
Yes, ma'am.
can you tell me why do we need calciums in our body?
Yes, ma'am. It activates the many enzyme in our body,
Hmm?
and it helps in the blood coagulation, cell division, metabolism of the glycogen, muscle contraction, bone mineralization, neurotransmitter, and the neuromodulator.
Okay, when you have to consider, when you have to treat a patient with hypocalcemia, what are all the procedures or all the steps that one should take?
Okay, during management of the hypocalcemia, I'll consider the cardiac monitoring of the patient by ECG,
Okay,
and
next,
I'll give the calcium supplement of the patient.
calcium
I'll
gluconate, IV. Okay.
gluconate, yes, calcium, magnesium sulfate, and
Okay,
then I'll
why is it important to give calcium gluconate IV over 10 minutes?
to prevent the any cardiac problem may happens if I give the rapidly the calcium.
Yes, being a physician, being a surgeon, you have to tell me what cardiac abnormalities are you trying
Arrhythmia.
to arrhythmias. Okay, very good. Okay, can you tell me in which form this calcium okay, okay, can you, if you can tell me in which form this calcium is transported in the body or is it's present in the body?
Calcium, ma'am.
Yes,
Calcium
calcium
gluc
in
calcium
which form?
bicarbonate.
In which form is it present in the body?
Yes, ionized.
Ionized, okay. And how much percentage is present
1% in
active?
1%.
Okay. All right, that's good. Please tell me, what are the functions of parathyroid gland which are important for the homeostasis of the calcium in the body?
Yes, ma'am. Parathyroid hormone. It's stimulate the enzyme that break down the bone matrix and release the calcium and phosphate in the circulation.
Okay.
Yeah, the parathyroid hormone also via the kidney excrete the phosphate and the absorption of the calcium, and
Yes.
it also activate the 1 alpha hydroxylase, which also activate the 1,2,5 dihydroxylase, and helps in the resorption of the calcium in the body.
Okay, can you tell me, out of all these functions, which functions take place in the bone and which ones are carried out in the kidneys, and where exactly in kidneys?
In kidney proximal convoluted tubules.
Okay. No, it's
Distal.
distal and convoluted tubules.
Yes, convoluted tubules.
What happens in kidney? One thing, calcium reabsorption takes place.
Yes, reabsorption
Where?
in the kidney.
In
Yes.
DT and CT. And then what happens? Inhibition of what happens? Three functions take place in kidney. So you have to tell me all three functions. Okay.
Yes.
What happens in intestine?
Yes, increase the absorption of the calcium and phosphate in the in the intestine, and increase the reabsorption of calcium and phosphate in the kidney.
Absorption of calcium and
Reabsorption,
increased
calcium and
production
phosphate.
of. There is something else happening. Come on. You have to think of the cycle. What happens in jejunum? Vitamin D is activated by the
Yes,
presence of what? Which
uh,
factor? Come on, you have to know the metabolism of vitamin D.
yes, ultraviolet in the
No,
skin,
not skin, in the intestines, jejunum.
intestine.
Okay, please tell me, what is calcitonin?
Is the calcitonin is the hormone helps in the calcium homeostasis in our body. It inhibits the reabsorption by inhibiting the osteoclastic activity, and it also excretes the sodium chloride, calcium, and phosphate from the by the renal system.
Okay, right. Please tell me why, because of hypercalcemia, patient presents with abdominal pain.
Hypercalcemia patient may present with due to the pancreatitis, maybe the cause of peptic ulcer disease or renal stone, ma'am.
Okay, what are all the hormones which are involved in the hemostasis of calcium?
Yes, the parathyroid hormone, the vitamin D or the calcitriol and the calcitonin.
Okay, right. If you could, all right, bell has gone. Um, what is the ideal way? Okay, I have already discussed this of managing hypocalcemic tetany. So you've already told me. And okay, right. Once you're managing the patient with hypocalcemia like this one, how
Yes, ma'am.
frequently one should manage the patient, and where are you going to manage this patient?
In the age due,
Okay, HDU or
I
critically
critically
ill in the, yes. Okay, but how frequently are you going to check patients?
every 2 hours.
Yes, yes, yes. Good.
Okay.
Right. Okay, good. Thank you.
Thank you, ma'am.